This is a survey from gynecologists published in 2009. They find that laxity as a finding among women who had children is more common than gaining weight or having stretch marks. So it is actually the #1 common finding among women who have had children. Next slide. And yet, women don't talk about this, right? So these are two surveys. Japan is on the left, United States is on the right. Question asked of the women: have you discussed your issues of vaginal laxity with your doctor? Looks like it's 3% in Japan and about 20% in the United States. But in the vast majority, about 60% of women who have vaginal laxity do not discuss this with anybody. And what are the possible reasons? They are embarrassed. They feel that the doctors will not understand. Doctor's not a woman, too young or too old, have never had children. So we know it's common. We know that women don't talk about it. Plus, in a very large survey of 27,500 individuals from around the world, this is a global sexual survey, in only 9% of individuals did the doctor even bother to ask. So women don't talk about it, doctors don't ask about it. So it remains this silent issue that we all live with. Okay, next slide. When we talk to patients about vaginal laxity, it's a very delicate topic, of course, and the way that some women may describe it is vaginal emptiness, as if water can flow in and out. But the vast majority of women, you can see down here, this is another survey, vast majority believe that some form of tightening or improving laxity will be of benefit to herself and to the relationship with a partner. So let's think about ways then how we can address vaginal laxity. Okay, next slide. In the past, we were very limited. One very common technique that many of us are taught by our gynecologist, obstetrician, are Kegel exercises. So this one, has anyone heard of Kegel exercises? Right, so I think it's not something that maybe among Asian patients are discussed commonly by our doctors, right? Is there anyone who's Singaporean who's heard about Kegels exercises except for Lynette? Lynette has heard everything. I know. So it seems like, yes? Okay. So Laurel is shaking her head at the back. So Kegel exercise, we're taught how to mobilize our pelvic floor muscles. How do we do that? When we're passing urine, we interrupt the flow of the urine. So we're taught to activate those muscles. Does that tighten the vaginal canal? Actually, it does not. What it does do is tighten the muscles of the pelvic floor. So it does not improve vaginal laxity. There are surgical procedures to address vaginal laxity. This is notoriously a painful procedure. As you can imagine, they're operating on a sensitive part of the body, notorious to have significant recovery and serious surgical complications. Plus, all it's doing is a mechanical tightening. It does not improve the health of the vaginal tissue, which is very different than the treatment we're going to discuss today. Next slide. So I'm going to introduce this procedure. You saw a video earlier today. I'll show you some clinical outcomes, and then I'll turn over to Caitlin to talk a little bit more in depth about the procedure. This is called Geneveve. The company is called Viveve. So for those of you who have done this treatment with us, it used to be known as Viveve, but it's not easy to say, as you can imagine. Geneveve uses radiofrequency technology. For any of you who have been to any clinic to go and ask about laxity or improving your skin, you know that radiofrequency is one of the mainstays for improving collagen. And so Geneveve uses the same radiofrequency technology as what is used for facial skin tightening, but it was developed specifically for the vaginal area. You can see the machine here, and the tip, this very little tip, is the size of a thumb, and only part of that enters the vaginal canal. And because of that, this is a very comfortable procedure that does not require anesthesia and has no downtime. Next slide. This is a different version of the vulva that you had seen earlier. This is a more medical version. This is the vaginal canal that you can see here. All we're doing is treating around the opening. If you remember, I said it is the outer third that is the most sensitive because it has the most nerves. And so the tightening occurs there. So the radiofrequency builds collagen with resulting skin tightening. In animal studies, they actually showed collagen growth after this procedure. Now I'm going to show you studies in individuals, in women. So this study on the left is very similar to what's on the right. What's on the left is in the United States, and what is on the right is in Japan. I will point out that in Japan, it seems that Viveve is very common also, or Geneveve, among patients who have never had children. So they do it just because they have had regular sexual activity and do this as part of their maintenance, healthcare maintenance. So this is an interesting study. This uses an outcome called the Vaginal Laxity Questionnaire. This is a validated questionnaire and is used in many publications when it comes to treatments for vaginal laxity. Very tight is the highest number, that is number 7. It goes all the way down to number 1, which is very loose. This is a woman's self-reported tightness. So it is up to me to decide what I feel is my tightness. What the study showed in both cases, first of all, before delivering a baby, so the first number you see here, on average, women were either in the neither tight nor loose range, or in the slightly tight range, or around 5 or a little bit higher. So that's a normal, healthy category for tightness. Once they have a baby, this crashes. So this plummets. It drops to 2.6 on average, which is in the moderately loose range. What they found with the Geneveve treatment is that after treatment, so the treatment is done at this point, here and here, within 4 weeks, there is an achievement of vaginal tightness to pre-pregnancy levels. So that is a remarkable result. So it is as if they never had a baby. So they begin to see the effect in month 1, and the clinical studies show that this effect persisted up to 1 year later, right? So the tightness markedly improved, whether among American patients or among Japanese patients. Next slide. This is a more recent study, and why this study is very important is because of the outcomes that were evaluated. First was the same questionnaire I talked about, so the sense of tightness. But second is the Female Sexual Function Index, or FSFI. What is that? Well, that includes the components listed here, exactly the components that Dr. Obadan mentioned. Your ability to orgasm, desire, arousal, lubrication, satisfaction, and discomfort during sexual activity. So this is a very important, if not probably more important than just the tightness. Okay, next slide. This is just consistent with the earlier slide. So this is a bit of a statistical term that may be difficult to understand. But what they showed, the active group, so the group that was treated, had 3 times greater likelihood of achieving significant tightness. Okay, so all that means is it becomes tighter. Okay, next slide. This is now the outcome for the sexual function that I was talking about. First, in this study, all of the women that were included were in a category that was considered dysfunctional. So they all had problems with orgasm, lubrication, and desire. The group that did not receive the treatment actually had an improvement in the sexual function. And this could be related to what Dr. Obadan was suggesting. Just being conscious of your sexuality may improve your sexual function. In that group, however, you can see that in about 6 months, it drops fairly quickly, and it never really achieves that level that we would like, the functional level. The treated group, the group treated with Geneveve, showed a marked increase in sexual function that persisted up to 6 months. It was most important for arousal, the ability of the woman to be aroused and to achieve an orgasm. This was based only on a single treatment. Okay, next slide. And this summarizes that very important study. 93% of the women that were treated who started with dysfunctional sexual score showed an improvement in sexual arousal and or orgasm. And there was no laxity whatsoever in the women who received the treatment. Most importantly, there were no side effects, no adverse effects or complications. Next slide. These are just some examples of what patients who have done these treatments have said. Most times, patients who are generally healthy, care about their overall appearance and health, are interested in this procedure as well. And so in this woman, I have had my breast lifted, a tummy tuck, and now Viveve. But most importantly, if you could see these 2 points here, that even partners recognized the results of the skin tightening. And in fact, one of our recent patients described within 4 weeks, which is the typical response rate, that the husband felt it was about 30% better or tighter. And so next slide. So who are the ones who can't do it? They are listed here. Those with issues with the vaginal anatomy, for example, prolapse. So if a woman has had multiple children, in occasion, the cervix and even the uterus can go down through the vagina. That is not a candidate for this procedure if it is moderate to severe. Obviously, if there is an infection, if someone has chronic pain, right? Medical issues, so if someone is on chemotherapy, for example, because they're very sensitive and already going through discomfort. Important to say that this has not, the publications do not include menopausal women, but women up to the age of 65 have been treated with this procedure. And next slide. This is just summarizing the benefits. It has no side effects. It increases production of collagen, as shown by biopsy studies in animal, but also improving tightness and sexual function, leading to greater pleasure for both the woman and her partner. So with that, next slide, I'm going to see if there are questions in the audience. Yes.
You mentioned about the childbirth. I have a question regarding to that. I don't know loud enough.
Okay, I'll translate.
Sure, okay. My question is that if you have a C-section during the childbirth, would that also lead to the vaginal looseness?
So that's an excellent question, right? So vaginal laxity definitely is aggravated by the child passing through. But remember what I said, that even regular sexual activity, even aging, leads to vaginal laxity. It is like our face. Basically becomes lax, right? And so there is, in fact, interestingly, Jeff was saying that in Japan, a large percentage of patients going through this treatment have never had children and just are regularly sexually active. Okay? Yeah? Okay. Any other questions at the back? Yes? That's a great question. So the question is, can someone in their 20s do this treatment? And so there is no cutoff for this procedure. This has been done in women as young as 18 years of age. And so the way you look at it is like saying, can someone in their 20s benefit from a tightening procedure on the face? It's a similar type of question. So the answer may be that it not as urgent as someone who is older, right? But if someone is interested in prevention, maybe a less frequent treatment may be of benefit. But it is certainly not as urgent or as essential as someone who is a little bit older.
Can I say that it's a prevention?
So I think, so when you look at collagen building, it's actually been shown that we start to decrease our ability to build collagen in our late 20s, just like muscle. Starting in our 20s, we have breakdown of muscle in collagen of a certain percent per year. And that's why we need to exercise, and that's why we need to build collagen also to reduce that laxity, the manifestation of laxity. So I don't want to say that this is a preventive treatment per se, but I will say that there are individuals who benefit from this, probably the ones who are quite sexually active at that age. Okay. Any other questions? Yes? That's a great question, thank you. So is the procedure painful, is the question. So in fact, there are a couple of great things about this particular device. So it has its own cooling system as part of it. So the cryogen cooling, so you actually feel a little bit of a strange spray, you'll even hear it. So the cooling protects the surface, the mucosa of the vagina. You feel a gentle warmth, and with that cooling, it allows us to reach a certain temperature that is effective in collagen building. So the answer is, it is actually not painful. So a lot of patients, since Lynette did say that she did the procedure, I will say during Lynette's procedure, she was talking to me about marketing issues. She was just chatting as if nothing was happening, right? So it is not painful. Okay. Any other questions? Yes? Your partner will notice that your intercourse is better. They won't necessarily say that you are tighter, although we do say that in our, as I said earlier, we have patients who have given feedback that the husband will actually put a number on the fact that they feel it's X% tighter. But when you look at it, it's of benefit to both sides, right? So there's greater friction on both sides. But also, if you remember the outcome that I showed with sexual function, so the ability to achieve orgasm may not be just because of tightness, but it may also be linked to improving the health of that sexual responsive part, the clitoral body and the clitoral arms that actually wrap around the vagina. Plus, if you believe in the G-spot, the Grafenberg spot, right? So it seems to improve vaginal health, not just tightness. Great questions from the back. Okay. Yes?
How long it can last? Because that's
Great question, yes. So we typically recommend, if you look at the studies, it's 12 months. The outcomes have persisted for up to 12 months. Not this one, the one, yes, one. So it's up to 12 months. But just like collagen building or like exercise, you need to do it. You need to maintain it, right? Even if you have a great fitness level, you need to keep exercising. So typically we say once a year, whether it's so it's a once a year procedure based on the protocols.
you might have to end up doing multiple times if required.
It's typically once a year. I think the multiple times was, Jeff was just saying to me, was in a 65-year-old woman. They did twice. And in fact, the sexual partner of that woman felt it was too tight, right? If that's even possible. So it's a once a year. Okay, so I think what I'm going to do, I'm going to turn over to Caitlin. Caitlin will give her presentation, which is still on Viveve, on Geneveve.
Thank you, Dr. Sylvia.